Many hospitals right now overwhelmed due to patients there for COVID-19 and a surge in other illnesses as well. And some hospitals right now have closed the doors, not accepting any new patients.
Right, and others are sending patients other places. Our Jenny Runovich learned a hospital in Arkansas today reached out to Methodist for help.
Kendra, call the desk, please.
The request came into Methodist Hospital in the middle of the night.
And I received a rather unusual call from our transfer center.
Unusual, not because a doctor wanted to transfer a patient here, but rather where that patient was located. Arkansas, 600 miles away. Every other hospital he tried was full and on diversion.
It was very alarming to me that the situation was so desperate he would reach out to a hospital hundreds of miles away. I've been doing this work for about 10 years, and I can count on one hand 2 or 3 times that I've had requests for a long distance transfer. Speaking to this other physician on the other end of the line, I could just hear this desperation in his voice about like, this patient can't stay here. And I think there was just a sadness that we both felt that we just couldn't help this patient within a reasonable distance from her home and her family.
That patient needed surgery in a high-level ICU, but Arkansas is running out of ICU beds, down to just 12 Tuesday.
Everybody has to realize this is not a good time to get sick.
It's a problem hospitals are facing nationwide, beds maxing out, staff running short, and a new surge in COVID cases making it all worse. Indiana is not at a critical stage yet, but analysts say the numbers show a troubling trend.
Over the last month, our hospitalization rates in Indiana for COVID-19 have quadrupled. Across the state, we're also seeing about 400 people a day come into emergency departments for COVID-19.
We're exhausted. To be very busy and to even occasionally have to turn away an ambulance or a patient is very distressing.
Dr. Hartwell shared that phone call from Arkansas on Twitter, adding, "Be patient with us, America. We are tired. We are crowded."
A little nugget of insight of what's it like to be on the inside of the hospital and what's it like at 3 o'clock in the morning to get a phone call from, a desperate physician hundreds of miles away. It's hard.
And it's scary. IU Health Methodist ended up not taking that patient from Arkansas last week, not because IU here is on diversion, but because that patient needed specific care that Methodist could not provide.